Hi, I'm Dr. Sanjay Azad, plastic surgeon at Thunder Bay in Ontario, Canada. This series called Surgery Basics is for educational purposes. I wish to thank Nicholas Nucci and Miranda Waugh, who have been instrumental in creating this series. This video is about interrupted sutures. This is something which everybody needs to know because it's the commonest suture in surgical practice. So I've got the needle driver, the tooth forceps and the scissors, which are the three elements which are used for suturing. So I'm going to pick up the suture. As you can see, this is a silk suture for demonstration purposes. It's got a sharp needle at the end. It's a cutting needle. And when you're holding the needle driver, hold it properly, and the needle itself should not be held too far towards the swedge. You hold it somewhere in the middle, or 2/3, 1/3, and hold it from the tip of the instrument. So when you are doing the suture itself, you've got to pass the suture, the needle should pass it perpendicular to the surface of the wound. So I'm passing it perpendicular to the surface of the wound. The forceps should be used minimally. You can hold the dermis or hold the skin only very gently, just for eversion purposes. And when you pass the needle through, you can see I'm just pushing it through through both the edges. Don't hold the swedge because you can damage the suture itself, and then don't hold the tip because as the business standard you need to use it. And then now my wrist is working to get this needle all the way through. Don't leave too long a stitch end because then it becomes difficult to suture. So I've still got the forceps in my hand, and as you can see, the stitch, this end has become small or short. So you've got a short end and you've got a much longer end. So now I'm going to sew using the 2-1-2 system, which is described in another video. So my first throw is 1 and 2 throws, okay? Then I'm going to hold this, the shorter end, and then draw the stitch across. So this is a surgical knot, as you can see. So the long end is going away from me, and I've got a nice surgical knot sitting there. And the knot is lying on one side, which is the fine adjustment, rather than letting it drop to the center of the wound. My second throw locks everything in, so I'm going to do a reverse loop of this, and you can see now the short end is coming away from me. So the long end and the short end are playing a little dance with each other, but my hands are not crossing. And finally, I'm taking another 2 throws and holding the short end, and this is again a surgical knot, and now this is done. So I've done a 2-1-2 suturing for this interrupted suture. This is the commonest suture which you'll use in most areas. The top tips to mention about this is that make sure that you cut the stitch short enough so there's no overlap with the neighboring suture. The fine adjustment should be done so that the knot itself is not lying on the center, but it's lying on one side. And then do remember, don't tighten the stitch too much because that can create issues and cause skin necrosis. Thank you for watching this video. In this series we have a lot of other videos to help you in improving your surgical skills.